Hi everyone. Let's begin with the rapid revision of the parasitology section where I've got you covered chapter by chapter that we are going to go and finish off this section, right? So let's begin with first, of course, the family of amoebic organisms, and the first one, as all of you know, is going to be the famous Entamoeba histolytica. So when I'm talking about the word histolytica, we all know that it's going to cause, histo means tissue, lytica means lysis. It's going to break the tissue. So when it comes to the intestine, it causes the very famous flask shaped ulcer. And if I zoom into this flask and if you ask me what exactly do you see inside a flask shaped ulcer, you're going to see these trophozoites. All of these are trophozoites that I am seeing for Entamoeba histolytica. And inside those trophozoites, do you see these red colored dots? These red colored dots are nothing but red blood cells. These are going to eat up red blood cells. Very important. That is what you see. But not only the intestine, does it also go and act on the liver? Of course, in the liver, what kind of pus appearance is noted? We see the anchovy sauce appearance in the liver. So if they ask you, how do you do the diagnosis of intestinal amoebiasis versus liver amoebiasis? So first, let me tell you the intestinal amoebiasis. So intestine mein kya karoge? You are going to take stool sample from the patient. Obviously, how many stool samples you should take? 3 consecutive days. You should not go for a single stool sample. 3 consecutive day samples are taken, and you can either look at it under the microscopic examination or you can go in for a stool culture. I'll come to the microscopic examination in a while. Under stool culture, let me finish off. There are 2 media that we had, if you remember, polygenic and azenic. Polygenic means you have added some supplements so that the parasite can grow. You have added some bacterial supplements so that your Entamoeba histolytica can grow. Whereas azenic culture media is a pure culture media. You have not added anything in it, right? So the only azenic one that you have to know is the diamond medium. Whereas under polygenic, you have all the others like the Nelson medium, the Balamut medium, the Bock and the Bolov's medium, and the Craig's culture. So I've learned that simple. Diamonds are very, very pure, right? Diamonds are very, very pure. So diamond is the pure azenic culture media and all the other come under polygenic. That is what you'll do with the stool culture. But if you have to look at the stool under the microscope, very important point. How do you differentiate Entamoeba histolytica versus the stool of Entamoeba coli? Because Entamoeba histolytica matlab disease. Entamoeba coli can be seen normally also. Now, when I talk about Entamoeba histolytica, and I have divided it into, one is the trophozoite and one is the cyst form. So please note, the trophozoite is something which will always show you engulfment of red blood cells, as I had shown you in a while. And this process is known as erythrophagocytosis. I hope you all remember this. Erythrophagocytosis is shown by the trophozoite. Also, how many nuclei does it have? I can see just one nucleus. I see one nucleus, and that nucleus has a central karyosome. If you look very carefully, it has a central karyosome. Versus, let me go on to the cyst form. In the cyst form, I see the same nucleus, but now the number has increased. And what is the number over here? It is going to have 1, 2, 4 nuclei that are present, but the composition is the same. It's going to have a central karyosome. What is this known as, guys? This is known as a cartwheel nucleus. A very famous question that you get in the paper, that how is Entamoeba histolytica different from the other members? It has a cartwheel nucleus. What else does the cyst have? The cyst has this big body, and that big body is nothing but the chromatoid body. Previous year question is, what is a chromatoid body made up of? It is made up of ribonucleoprotein. Very famous PYQ, ribonucleoprotein. Coming on to Entamoeba coli, तो जो पढ़ा था वो opposite कर दो. In Entamoeba histolytica, in the trophozoite form, you studied that it shows you erythrophagocytosis. This does not show you any erythrophagocytosis. That showed you a central karyosome. This is going to show you an eccentric karyosome. That had, okay, one nucleus. This also has one nucleus. But when you look at the cyst, how many nuclei did it have? Entamoeba histolytica had 4. How many is the Entamoeba coli going to have? It's going to have 1 to 8 nuclei. Okay, Entamoeba histolytica also had a chromatoid body. This also has a chromatoid body. But the chromatoidal bars are very, very thin. They are very thin body of bars. But the composition is the same. That is ribonucleoprotein. So quickly, how do I differentiate the trophozoite of both of them? This has RBCs, this does not. This has a cartwheel central karyosome, this does not. Talking about the cyst, 1 to 4 nuclei. Entamoeba coli has 1 to 8 nuclei. This again has the cartwheel nucleus. This does not have the cartwheel nucleus. This has a very thick bar, whereas Entamoeba coli has very thin bars. The composition of the bars is going to be the ribonucleoprotein. So now tell me, I can see a single nucleus over here and I can also see one more structure over here. So that means this must be red blood cell. If red blood cell is seen, this is the trophozoite of what? This is the trophozoite of Entamoeba histolytica. Okay, next one. If I look at this, I can see there's a cyst form and I can see that chromatoidal, that thick chromatoidal body is also there, and I can see one nucleus, but where is the dot? The dot is right in the center. So this again means this is the cyst of Entamoeba histolytica. Versus look at these pictures. Ma'am, the number of nuclei in these cysts is 1 to 8. They are much more than that. So basically when you're seeing 1 to 8 nuclei, what are you dealing with? You're dealing with the cysts of Entamoeba coli. So all said and done, you have done the diagnosis of this intestinal amoebiasis. How are you going to do the diagnosis of the liver amoebiasis, Anchovy sauce appearance? Please note that for the diagnosis, you will see the trophozoites. You will take this Anchovy sauce and you will see the trophozoites in this Anchovy pus that you have got. That is how you do the diagnosis. All said and done. Sab pad liya. What about the life cycle? Now you'll understand. Which is the form that we are going to eat or drink? The mature cyst. Please remember, the mature cyst has how many nuclei? Socho, ma'am, you said 1 to 4 nuclei hote hain. So 4 nuclei must be the mature form. So I can say the quadrinucleated cyst is the mature form, correct? And what did I say? We are eating or drinking it. So what is going to be the mode of ingestion? It is going to be a fecal-oral route. Infectivity dose is very, very small. You need a very less amount of parasite to enter and cause a problem in the body. So if they ask you question number 1, mnemonic number 1, which are the organisms that have a small infectivity dose? Your answer is chota small. So let's quickly make a list. C stands for Cryptosporidium. This list I'm telling you for everything from parasito to bacteria to all. H is what I'm talking about over here. Entamoeba, which one? Entamoeba histolytica. The last H that I'm talking about over here is enterohemorrhagic E. coli. S is going to be Shigella. And lamb ulta pado, small ko lamb ulta pado sounds like Lamblia, Giardia lamblia. It is going to be Giardia lamblia. So repeating guys, this is going to help you everywhere in microbiology. Cryptosporidium, Entamoeba histolytica, EHEC, Shigella and Giardia lamblia, they are going to have a chota small, they are going to have a small infectivity dose. Finally, coming to the treatment aspect, I hope you know we have to give metronidazole for 10 days, but we also have to kill the parasite in the lumen of the intestine. So we give a luminal amoebicide called paromomycin. So if they say there is just a carrier, the person does not have any trophozoites and cysts coming out in the stool, sirf carrier hai. Should you be giving a luminal amoebicide? Yes, because there could be parasites in the lumen. So metronidazole and paromomycin both have to be given. Entamoeba histolytica ho gaya. I've also told you the difference with Entamoeba coli. We move on to the next family, and those are the free-living amoeba. Just 2 slides and we are done. Free-living amoeba include Naegleria fowleri and Acanthamoeba. What do they cause? They cause PAM and GAM. PAM and GAM is what? PAM stands for primary amoebic meningoencephalitis. PAME, primary amoebic meningoencephalitis. And you know how does this happen? When someone is swimming, this is associated with swimming. So swimming ke through, the water goes to the nose, cribriform plate and up to the brain. So it's basically a nose ke through, swimming se related history will be there. And once the person gets the infection, things happen very, very quickly. It is an acute disorder. They will say the person was swimming and 5 days later the person has had encephalitis, meningitis, died off. Everything will happen fatafat. That is going to be Naegleria fowleri. So which is the form that is going to go and cause infection? It is primarily the trophozoite which is going to cause infection. And how is it going to spread thereafter? Nerves mein ja raha hai na, brain mein ja raha hai, it's going via the nose, cribriform plate and brain. So the spread is going to be neural. Versus when I talk about Acanthamoeba, it does not cause primary amoebic meningoencephalitis, it causes granulomatous amoebic meningoencephalitis. So here I can call it GAM. Granuloma, my pathology lectures tell me granuloma is a chronic inflammation, so clinical course is going to be chronic. So how does this occur? This is very commonly seen in HIV positive patients. तो कोई HIV immunodeficiency का history होगा, and immunodeficiency में तो ma'am everything is infective. Trophozoites are also infective, cyst is also infective. So remember, in Naegleria only the trophozoite was infected, whereas in Acanthamoeba you will realize Acanthamoeba में सब कुछ everything is infective, trophozoite and cyst. And what is the spread? This is going to spread via the blood, because this is not directly going and eating the brain. This is going to spread via the blood. In fact, if I ask you, can it also cause corneal ulcers? Yes, I have read about this in ophthalmology. This can also be associated with corneal ulcers. Now let's do the differences in terms of microbiology. So what is the diagnosis going to be? Ma'am, Naegleria fowleri सीधा goes via neural into the brain and eats the brain. So CSF ले लो. Please take CSF and you can see the trophozoites and you can see the increased WBCs. You will know there is a meningoencephalitis happening. Whereas acanthamoeba, you will have to do a biopsy and find out what all, everything. In acanthamoeba, you see both trophozoite and the cyst, and let me show you that picture to you also in a while that I will, how trophozoite and cyst look like. Culture दोनों का ये same है. Culture and the gold standard is the same. So culture के लिए for both of them you use NNA with E. coli. What is NNA? If you want to know, it is a non-nutrient agar. Although you don't have to know the full form, you use a non-nutrient agar with a ln of E. coli, that is for both. And obviously PCR, nucleic acid amplification testing, is also going to be the same for both, and that is the best, of course. What is the treatment going to be? For Naegleria fowleri, it is going to be amphotericin B. But for acanthamoeba, because immunodeficient situation mein tha na, it becomes very difficult to treat. So you actually have to give a combination of drugs like pentamidine, azole, sulfonamide, flucytosine. All these combination has to be given so that you can treat this person. So if I give you this kind of a life cycle where there is a history of swimming will firstly tell you about Naegleria, and which is the only form which is going to come to you. Ma'am, cyst nahi aayega, isme sirf trophozoite wala form is coming to us. Only the trophozoite form is coming through our nose, going to the brain and causing primary amoebic meningoencephalitis. Only the trophozoite. Whereas if I show you a case of acanthamoeba, you will say, ma'am, acanthamoeba mein I can see that the trophozoite is also coming and the cyst is also coming. Everything, all of it is coming in acanthamoeba, and this will usually be an immunodeficient patient. So how will it look like under the microscope? This is a trophozoite and this is a cyst. What did you see in trophozoites? Can you see some porcupine-like spikes coming out? Yes, everyone can see that. So please remember, acanthamoeba is gonna, if you ever noticed, what is the meaning of the word acantho? Acantho means spikes. So yeah, I will see acantho, but if I look at the cyst, how many walls of the cyst can you see? I can see a double-walled cyst, right? I can see one outer wall, one inner wall, and वो wall smooth नहीं है, ऐसा irregular wall है. This is a wrinkled, especially outer wall. There is a wrinkled wall that you see. You can zoom in and notice this is a wrinkly kind of a wall that is present. In fact, there is another organism that might look very, very similar to acanthamoeba, and that is the Balamutia mandrillaris. Please note, this mandrillaris, Balamutia, also causes the same thing, granulomatous amoebic meningoencephalitis. So ma'am, how will I differentiate it from acanthamoeba? Because that also causes granulomatous amoebic meningoencephalitis. That also shows trophozoite and cyst. This also shows trophozoite and cyst, and it's in front of you. You can see that the cyst is round and it is double walled, but the trophozoite is different. Ma'am, acanthamoeba mein you told me acantho, spiky trophozoite hoga. On the other hand, this Balamutia mandrillaris, this is showing me a fish. Can you see the trophozoite is looking like a fish? It is very, very fish appearance. That is the appearance that you see. That's one difference. The second difference is acanthamoeba was more commonly seen in which individuals? It was more commonly seen in immunodeficient individuals, whereas this infection can be seen in both immunocompetent as well as immunodeficient individuals. I hope that is okay with everyone, because we are done with these. We are going on to another coli which is totally different from all the others. Very, very famous, Balantidium coli, and the mnemonic for Balantidium coli is going to be Balantidium coli itself. Means what? Firstly, from coli you will call it celi. This is the only ciliated parasite that is going to infect the GIT. The only, coli matlab celi. Now you will ask me which part of the GIT, so I'll say B for Bada. This means, Bada means big intestine, the large intestine is affected. Anything else with big? Yes, this is the largest protozoan that we have, the largest member that we have in this entire amoeba family. The largest is also Balantidium. The intestine is also going to be large intestine. Now they will ask you that how is it going to look like under the microscope? So another B. These are all going to be binucleated. When I say binucleated, it means that the trophozoite and the cyst, both of them have two nuclei. This is the only organism where they ask you a question that which is the only organism that the trophozoite and the cyst have same number of nuclei. Quick revision, इससे पहले we did Entamoeba histolytica and Entamoeba coli. Did you see in Entamoeba histolytica, trophozoite had one nucleus, but cyst had 4 nuclei. Then in Entamoeba coli, trophozoite had one nucleus, but cyst had 8 nuclei. So cyst always has more. This is the first organism where the trophozoite and the cyst have same number of nuclei. So let us quickly draw it out. There is a big nucleus. Again, look at their names. The big nucleus is going to be bean shaped and the small nucleus is just like a dot. तो अब सारे B's एक साथ कर लो. Remember, this is going to be big for big intestine, large intestine, big for big size, it is the largest. B for it is only the one that is binucleated in trophozoite and in cyst, out of which remember the bigger one is bean shaped. So I will always see a big nucleus which is going to come out to be bean shaped, and if you see this over here, it's very difficult to pick it up. Right, but over here, ma'am, I could not see the nucleus. आपने बनाया तो I kind of imagined, but can you see some dot 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 coming out? At least you can see the cilia coming out from here, right? So either you will be able to pick up the cilia or you will be able to pick up the bean-shaped nuclei, and that is how you will identify Balantidium coli. That basically wraps up our entire amoeba family from Entamoeba histolytica, Entamoeba coli, Balantidium coli, and all the free-living amoeba. The next family that we start off with is going to be the flagellates. Let's begin with the next part, and those are the flagellae, which include the angry uncle, which is Giardia lamblia, and the fashionable auntie, which is Trichomonas vaginalis. I hope you remember those stories and mnemonics from the main videos, and if not, quickly catch on to these mnemonics now. So when I start with Giardia lamblia, as I called him the angry uncle, he's the angry old man of the duodenum. I'll tell you what. This is the most common parasitic infection that we have in the world, and it is also the most common parasite found in the stool. So if I show you the life cycle and I ask you that where is this going to go and sit in my body, you will say that, ma'am, it's the angry old man that is present in the duodenum. So angry old man. Now, why are we calling him old man? He's Dadaji. He is Dadaji, so I'm going to keep on adding this mnemonics in front of his name. So he's the Dadaji because he stays in the duodenum. So what is the form and how are we going to have it in the body? This is going to come via a feco-oral route, and the infective form is going to be the cyst. I hope you remember it's a part of that chota small mnemonic, which means that it is going to have a small infectivity dose. So now once the cysts are going to come inside the body, and of course every cyst will transform into trophozoites, you need to know that it's going to go, Dadaji goes to the duodenum, and what all does it cause? So it's very famous for causing malabsorption. The feature that it causes is malabsorption, be it fat malabsorption, iron malabsorption, B12, folic acid, different malabsorptive symptoms are going to be seen when it comes to Giardia lamblia. Okay, so now I need to know that if I have a diarrhea sample, what are the forms that I'll be seeing? So firstly over here, I called him Dadaji because Dadaji is going to be seen in duodenum, point number 1. Secondly, you will say, ma'am, these two forms, this is trophozoite and this is cyst, right? Where are you seeing them? So the sample that you will be taking from the patient will be number 1, a stool, diarrhea wala sample. Right, so if I look at this, this is looking like the face, or you can say the trophozoite is looking like a pear shape. Some people also call it a tennis racket appearance, right? So it's looking like a tennis racket, and because it's a human being, Dadaji is a human being. So how many eyes will Dadaji have? 2 eyes. So how many nuclei does it have? It's going to have 2 nuclei. And old man, now old man will have a white beard also. So old man has how many hair over here? 4 pairs of flagella. Can you see these flagella coming out? Very, very important, guys. 4 pair flagella, not 4. 4 pairs means there are a total of 8 flagella that are coming out. So like a human being, he has 2 eyes, 2 nuclei, and he has 4 pairs of flagella coming out and looks like a tennis racket. That's the trophozoite. When you come to the cyst, how many nuclei do you see? So the cyst form is going to have 1 to 4 nuclei, and cyst never has a flagella coming out of it. So where did you see this? You saw it in a stool sample. You say, no, ma'am, stool sample, I did not see it. Now what do? I can do something known as a string test, and string test is also known as an entero test. Entero means it's going to go into the intestine. Now socho, I want to send this string into the intestine. Which part of the intestine do I want to send it to? Dadaji is sitting where? It's in the duodenum. So I'm going to send this string, that is why you're calling it a string test, way down into the duodenum, and then I'll get the sample on this string, and then I will look at it under the microscope. So have a look at some more pictures. Can you see this pear-shaped organism here and this pear-shaped organism here? So I can definitely see, yeah, it's a pear shape. I can see the 2 beautiful eyes that we were describing. So definitely trophozoite hai. Ek aur photo dekho over here also. This is the best picture. Yes, I can see the 2 eyes and a flagella coming out. 2 eyes and these flagella coming out. So nice. These are all trophozoite forms. How is the cyst looking? Cyst does not look exactly how you saw it under the, diagrammatic picture. But this is the picture that you'll always get. So rat lo. This is what you see in the cyst. Roughly 4 nuclei are seen. So how many nuclei? The cyst shows you the presence of 4 nuclei, and that is what is the cyst form, which is infective form of Giardia lamblia. But what if you see the same Giardia lamblia in a pathology specimen? Please note it is going to be, what did I say, lumen mein hota hai. Can you see? It's a Giardia is going to be a luminal organism. Number one. Number two, ma'am, it's not looking like the tennis racket. Why? Because tennis racket is going to look like this. When I was showing you the front view, it was looking like a tennis racket. Now if I show you iska side view, it will look like a sickle. Say front view is tennis racket, side view is sickle. So in the pathology slides, this is going to look like a sickle shaped organism. It is a sickle shaped organism. So lamblia told you that it's a luminal organism. What else? This Dadaji is, although he is Dadaji, but he is still in the Shah Rukh Khan phase of Mohabbat. Means you've seen the leaves which are falling in all the Shah Rukh Khan movies that are there. So this Dadaji is going to show you the falling leaf motility. The Giardia lamblia is known as Girta Hua falling man. So falling leaf motility is noted over here. So if I had to summarize all these mnemonics, firstly I called him Dadaji. Why? Because he's going to go into the duodenum. Then he has 2 eyes. That is why we say there are 2 nuclei. Then he has these 8 hair coming out. So we have 4 pair flagella. If he has flagella, he is the Girta Hua Dadaji. So he's going to have the falling leaf Girta Hua man, that is falling leaf motility, which is very, very important. Finally, I am going to put it up on the auntie now. It's time to go to the auntie, but before that, what is the treatment? I think everyone knows the drug of choice is going to be the metronidazole, but what is more convenient to give as a single dose is a tinidazole 2 gram. Tinidazole 2 gram can also be given. That was about the angry old man of the intestine. Now we come to the fashionable auntie, and that fashionable auntie is Trichomonas vaginalis, which is one of the most common causes of sexually transmitted disease and non-gonococcal urethritis. So what is the habitat? All the genital areas are the habitat. Females may it's going to be vagina, urethra. Males may it is urethra, prostate. So all the genital areas are going to be the habitat, and of course the mode of transmission is sexual. We all know it, but reservoir kaun hai? Reservoir females hai. Females are said to be the reservoir. What is the infective stage? Everywhere till now I have mostly been saying infective stage is cyst, mostly. But here with Trichomonas, the problem is that tri tells me that there is no cyst form. Trichomonas has only trophozoite form existing. There is no cyst form possible for Trichomonas. So whether someone asks you what will cause the infection or how will you do the diagnosis, kuch bhi pucha, answer is always trophozoite. Trichomonas, trophozoite. So now let's come to the story of the auntie that you have. So males mein to kya hoga? It's going to cause a discharge, urethritis and prostatitis, discharge hoga. And females mein there is going to be a very famous thing. So this is going to be strawberry cervix. Females causes or shows you the strawberry cervix. Can you see these red spots on the cervix? So this is going to be the strawberry cervix. Okay. What is the color of the discharge? Usually females come to you with a greenish color discharge when they have a Trichomonas vaginalis infection. What do you see as them as a motility? They very famously show you the twitching motility. The twitching motility, also known as the jerky motility, is also one name given to it. But yeah, twitching and jerky motility is what is said. Now coming to the culture. Please note, for culture we have 2 media. One is the lash cysteine hydrolysate serum. One is going to be the diamond media. अब ये सब कैसे याद करेंगे? I'll tell you in a while. But now you tell me that before you grow it on a culture, you say that, ma'am, first I will always look at something under a microscope. So there's a female. She's come to me with a greenish color discharge and a strawberry cervix. And when I look at it under the microscope, which is the form do you think that I'm seeing over here? Of course, trophozoite. Only trophozoite form can exist. And now tell me that how many nuclei do you see over here? I see 1 nucleus. How many flagella do you see? 1, 2, 3, 4. I see 4 anterior flagella going aage, of course, anterior. And then I see 1 flagella going all the way back like this. So there is 1 posterior flagella. And why is it going as a zigzag? That zigzag thing is known as an undulating membrane. This zigzag thing that you are forming over here, this is referred to as the undulating membrane, this zigzag appearance. So now total kitna flagella hua? Ma'am, 4 are going towards the front, 1 is going towards the back. So 4 plus 1 makes it 5 flagella. So अब difference पता लग रहा है. See, Giardia lamblia was a man. How many eyes? 2 eyes. How many nuclei did he have? 2 nuclei. How many nuclei does this have? Only 1. Giardia had how many flagella? 4 pairs. 8 flagella. This has 4 plus 1. That is 5 flagella. So have a look at this. This is also pear shaped, but nucleus single nucleus है. यहाँ पर भी pear shape, but everywhere you will see only one nucleus inside it. That is a Trichomonas vaginalis. So now comes the story of this fashionable auntie. See, fashionable auntie matlab she is gonna love the fruits. Which fruit? She loves exotic fruits like strawberry. So coming to this, she loves exotic fruit like strawberry. So what is the cervix, guys? Strawberry cervix. And strawberry के ऊपर green होता है, तो trichomonas का discharge का color, it is going to be a greenish color discharge that the female will have. Next, why am I calling her fashionable? Because look at her hairstyle. She's got a fringe cut. आगे she's got 4 flagella. Okay, she's got 4 anterior flagella. She's got a fringe cut, and then she has a one long ponytail at the back. ऐसा zigzag zigzag, one long ponytail at the back. So one posterior flagella. Also, because she's got hair on the front, उसका एक आंख छुप गया. So how many eyes does she have? So ma'am, her hairstyle is such, her eye has only gone up. Only one eye is visible. There is only one nucleus that you see. Also, she's so fashionable, ma'am. She has put eyelashes. She has put fake eyelashes. So what is the culture media? It is the lash cysteine hydrolysate serum. Lash media है. दूसरा media कौन सा है? She's fashionable. She loves diamonds. So दूसरा media is gonna be the diamond media. That is your entire story of a fashionable auntie, which covers everything that you studied over here, from the strawberry cervix to the greenish discharge to the eyelashes wala lash media, diamond wala diamond media, her 4 anterior flagella, 1 posterior flagella. Everything is done. What is the treatment? Again metronidazole, but it's a male female STD. Treat both the partners. I hope these stories are okay for you. The angry old man, Dadaji of the duodenum, and now we have the fashionable auntie, because now we are going to switch the family and go on to the next. These are known as the hemoflagellates. Let's begin with the next part, and that is the hemoflagellates, and this includes the leishmania as well as trypanosoma. Before I begin with them, you should be familiar with what are the forms and the types that are going to be there, which is famously learnt as the mnemonic APET. What is APET? Amastygot, promastygot, epimastygot, and trypomastygoid. So all of them, you can see they have a flagella coming out, hence I call them hemoflagellates, right? But which is the one where the flagella does not come out? So A for amastygot, and that is not going to have a flagella, so A for absent flagella. How is the flagella coming out? I see one structure over here. What is the N for? N is going to be the nucleus. And this P and B, P for parabasal body, B for blepharoplast. Ek saath, what are you going to call them? You're going to call them the kinetoplast. So there's one nucleus and there's a kinetoplast. And from the kinetoplast everywhere, the flagella is coming out. So please note, in all these forms, the kinetoplast is in front of the nucleus. Kinetoplast is going to come in front. Where is the kinetoplast going to be? Behind the nucleus. So I see over here that in this situation, the kinetoplast is post-nuclear, and that's the question that you get, especially important for INI CET students. Now let's go forward and see that out of leishmania and trypanosoma, who shows which of these forms. So there is a bet that I'm telling you. Cats are very frisk animals, isn't it? So I'm giving you a bet. Bet that you cannot keep the cat on your lap. The cat is going to run away. So I'm giving a bet. What does that bet mean? B stands for trypanosoma brucei. C stands for trypanosoma cruzi, and L stands for leishmania. And now the forms are in front of you. Bet means brucei has epimastygot and trypomastygot. Cat, amastygot, trypomastygot, epimastygot, and cruzi. And lap, leishmania has amastygot and promastygot. So simple. Bet that you cannot keep the cat on the lap. Out of them, I am now going to tell you that each one of them has an insect. Kahin bug hoga, kahin fly hoga. Everywhere there will be an insect, and which is the form that is only seen in insects, not seen in humans. So that is going to be the epimastygot form. So how I have learnt it is, aaj se yaad rakho, insect, and that is going to be epimastygot. Okay, so insect is going to be epimastygot form. Now let's go forward. Which insect am I talking about? So when you say trypanosoma cruzi, cruise, living the life in the cruise, matlab a super duper life. And that will remind you of Anil Kapoor and his dialogue Jhakas. So remember, cruise mein jana matlab Jhakas life. That is going to be Chagas disease. And trypanosoma will remind you of the bug, and that is going to be the triatomine radiovid bug. Next, we talk about Trypanosoma brucei. Brucei is going to cause SNS, that is going to be sleeping sickness, and this is of many types. There is a West African sleeping sickness, East African sleeping sickness, matlab all Africa wala countries, and S is going to be for CC fly. CC fly for sleeping sickness. Ab all this was Africa, so where is the America wala? So this is the American, the South American sleeping sickness, then becomes the Chagas disease. Coming to the last one, that is Leishmania. I don't even want to mention, we all know it causes Kala Azar, and the vector is going to be sandfly. Do you want to see their life cycles? Vectors ho gaya, forms ho gaya. If you've learned bet you can't keep the cat on the lap, if you've learned the vectors, let me take you to the life cycle. As soon as you will see triatomine radiovid bug, you'll say, oh, Trypanosoma cruzi, matlab bet you can't keep the cat. Cat mein, ma'am, Trypanosoma cruzi will have amastigot, trichomastigot, epimastigot, out of which is the form that you'll see only in the insect. Epimastigot will only be seen in the insect. So remember, the form that comes to us is trichomastigot, changes to amastigot, changes back to trichomastigot. That is taken by the insect again. So trichomastigot is taken. Epimastigot is formed, and then once again it's going to form a trichomastigot. So if I ask you what is the form that is going to enter us and leave us, so ma'am, Trypanosoma cruzi mein trichomastigot enters, trichomastigot leaves. So either humans mein chalega tat, and then insect mein chalega tet. Tat, 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 tat cycle is going to go on, and you will always know epimastigot will happen in the insect only. Next one we come to is Trypanosoma brucei. Bet means you are going to have epimastigot and trichomastigot. So humans में कौन सा form होगा? Trichomastigot. Insect में कौन सा होगा? Epimastigot and trichomastigot. Both are going to be seen. And which fly was there? This was the CC fly. A CC fly matlab sleeping sickness. I know it is a case of brucei. Coming to the last one, what is Leishmania? Bet you can't keep the cat on the lap, ma'am. There are only two forms. Ab insect and human का कुछ नहीं है. Amastigot and promastigot are seen in insects also. Amastigot and promastigot are seen in humans also. I identified it by the sandfly because the sandfly is definitely something that is seen in Leishmania, Kala Azar. So your three life cycles are sorted. Now I'm going to go on to the diseases one by one. I'm first starting with Trypanosoma cruzi. Cruise life, best life, jackass life. So Chagas disease, triatomine, radiovid bug known as American sleeping sickness is of two types. Acute Chagas disease, chronic Chagas disease. Acute Chagas disease shows you this sign that is in front of you. The Romanas sign. What do you see in this female? There is a periorbital edema. There is a periorbital edema that you notice in this female. Now over here, when it goes into a chronic state, firstly, cardiac involvement. These patients are going to have myocarditis. Secondly, all the organs in the GIT are going to become mega. If I say what happens to the esophagus, you will say mega esophagus. To the colon, you will say mega colon, right? What sample will I take? I can either take a blood sample or I can take a Buffy coat sample from these people. Blood sample or Buffy coat sample. So theek hai, before culture, if you took a blood sample, what did you see over here? There are some C shape, and let me see if you've been listening to me carefully. ठीक है, flagellated organism है ma'am, and this big wala dot must be the nucleus. But behind the nucleus, I see a dot called the kinetoplast, and from there I can see a flagella is coming out. Post-nuclear kinetoplast, nucleus के पीछे है kinetoplast हर जगह. That means this is going to be which form? This is the trichomastigot form that you are seeing over here. Lastly, what culture are you going to do? We do the triple N culture media over here, and what is the treatment? It is done by benzimidazole. Benzimidazole is the treatment, otherwise you have to give supportive symptomatic treatment also. So now I've got a story for all of you, which is a story of a very, very rich American couple. Firstly, what is the concept of calling them American? Because I am talking about something known as American sleeping sickness as of now. Okay? Now, why am I calling them rich? Because they have decided that we are going to travel by a cruise and we are going to go all the way to Rome, Italy, Rome. ये हमारा cruise से we are going to travel over here. So cruise is going to tell you what? Cruise shall tell you that they are going to be Trypanosoma cruzi का बात हो रहा है, right? And where are they traveling? They are traveling all the way to Rome. So what is the sign going to be? We are talking about the Romana sign, the periorbital edema. And if someone is going to the cruise is rich, of course. He's going to the cruise not in public transport. He's going to go by Mercedes, Merc. What is the Merc Benz going to tell you? The treatment is going to be benzimidazole. The treatment is going to be Benznidazole. Finally, I say that I have said that of course they are living the best life, they are living the jhakas life. So that is going to be the Chagas disease. And of course, they are going for their honeymoon. Honeymoon means that is there going to be myocarditis? Means is there cardiac involvement? Yes, there is a honeymoon. That is why they are going on a cruise, they are going to Rome and all of that. And of course, so rich, ma'am. You will say, "Arey, ma'am, favorite Indian dialogue, bade log, badi baatein," because everything is going to be huge. There is going to be mega esophagus, there is going to be mega colon, and that is the entire story. A rich American couple traveling by Mercedes-Benz, Benznidazole, going in a cruise, cruisy disease, going to Rome, Romana sign, leading the Jhakas life, Chagas disease. They are on a honeymoon, so myocarditis, bade log, badi baatein, mega esophagus and colon. That's the beautiful story. But now I want to ask you, what are all the parasites that cause myocarditis? How are we going to learn it? I am saying what are all the parasites which cause myocarditis. Myocarditis करने के लिए you have lots of T and E. Means I've just taught you the famous Trypanosoma cruzi, है ना? अभी पढ़ा Trypanosoma cruzi. In a while I will even teach you Trypanosoma brucei rhodesians. Apart from that, later on in nematodes we will do Trichinella. Then we have something known as Toxoplasma, which is the next chapter. And also sometimes we can have Echinococcus or the dog tapeworm that can cause it. So all the T's that you study along with Echinococcus, that is going to cause myocarditis. The Chagas disease is done. Now we go on to Trypanosoma brucei. Brucei means that I'm talking about sleeping sickness, and sleeping sickness means that the vector is going to be the tsetse fly. Please note that one of them is West African and one is East African. So for that you will have to learn a mnemonic that the sunrise is going to happen in the east and the sunset matlab game over, that is going to happen in the west. So sunrise is going to happen in the east, which means ke rise, rhodesians, is going to be East African sleeping sickness. Sunrise, rhodesians, East African. Whereas game over, ma'am, sunset, game over is going to happen in the west. Which of them can happen in humans and animals and both? So remember, East African में A आता है, तो animals में किस में होगा? Animal involvement will happen in East African sleeping sickness, whereas West is only to do with humans. So East African mein there is going to be animal involvement. Next, which of them, the most important question, which of them shows you the winter bottom sign? Firstly, what is winter bottom sign? Winter bottom sign means there's a lot of lymphadenopathy that is present. So W for W, winter bottom sign will be seen in West African sleeping sickness. Which of them is going to be more parasitemic, more virulent, more resistant, difficult to treat? Sara, difficulties are by East African, because when someone is rising is the real struggle, isn't it? It is the real struggle. You are more ferocious, you are more aggressive, you are wanting to put in that extra work. That is what this rising rhodesians is doing. It is more parasitemic, more virulent, more resistant. That means that for treating Gambians, though I can use pentamidine, but for treating rhodesians, I will need something called Suramine, which will be more effective against East African sleeping sickness. Sorted with this as well. With the treatment in one table, we are done. I hope no other confusion. Most expected question. Winter bottom sign is seen in West African sleeping sickness. Coming to the last one, leishmania. Let me take a test. Come on, guys. What was the vector? The vector was sandfly. What disease am I talking about? Of course, we are talking about Kala Azar. And Kala Azar, basically, why did we call it Kala? Because there is a blackish discoloration or a pigmentation that occurs in the skin. And you can also see a protuberant belly because these kids are going to have hepatosplenomegaly. Now there are two forms. Remember, LAP means amastigot and promastigot. So remember, the diagnostic form is going to be amastigot. That is how do the diagnosis. That is what you see as LD bodies. You see LD bodies, na? LD bodies are nothing but amastigot. Whereas the infective form is going to be promastigot. So pro is like pro. It is the one that is going to cause infection. Amastigot is for diagnosis. So now let me come to the diagnosis. The most sensitive area to take a sample from is the spleen. Puncture the spleen, you will see the LD bodies, but spleen is very vascular. There are a lot of risks present. Bleeding ka risk hai, puncture ka risk hai, a lot of risk. So what is going to be the more preferred site is going to be bone marrow and blood. And in HIV people, bronchoalveolar lavage can also be done. So once you have punctured any of these, what are you actually going to see under the microscope? You will say, ma'am, you just told us that the diagnostic form is the amastigot form, which means the leishmania LD bodies. And till now you have told us that the organism is not going to be just the nucleus. Organism में सिर्फ nucleus नहीं है. Nucleus के साथ there is a छोटा dot, kinetoplast. Every LD body will not only have a nucleus, it will also have a kinetoplast. So in short, you will say, ma'am, one big dot and one small dot. So if I zoom in, firstly, I can see a huge cell over here, and that cell is nothing but a macrophage. And I notice that all the organisms have a big dot and a small dot, big dot and small dot, big dot and small dot. Yes, now it becomes so easy to pick up. If you look at the other picture also, everywhere there is big dot, small dot. So these are all the LD bodies that you're talking about, big dot and small dot, nucleus and kinetoplast. Fine. Then you will ask me that because it's a parasitic infection, is there going to be an increase in the immunoglobulins? Yes, there is aldehyde and antimony test for immunoglobulin. No one does it now, honestly. It's only for your MCQs. Napier's aldehyde and Chopra's antimony test is used over here. What is the media? The media once again is the triple N media, but on the media what you see is the pro-mastigot form. So now you are going to make a small little table and tell me that triple N media को कहाँ use करा था? Triple N media was used for Trypanosoma cruzi, and now it is being used for Leishmania, right? These are the two organisms on which you are using triple N media. So what you see under microscope is amastigot, but what you see on triple N media is pro-mastigot. What is the famous antigen test? RK39. RK39 antigen card testing is done for Leishmania. PCR is of course the most definitive. Kala Azar ka treatment has been asked in the paper, liposomal amphotericin B. So this bachche ka picture was given with a belly and a kala, blackish discoloration. Liposomal amphotericin B. So you gave liposomal amphotericin B for 1 to 2 years, and after that what happened? So 1 to 2 years after treatment, sometimes the patient will land up with these kind of hypopigmentations, and these hypopigmented nodules will be post Kala Azar, and skin par hai to dermal. Post Kala Azar dermal leishmaniasis occurs 1 to 2 years after treatment, shows you hypopigmented nodules, and the treatment is going to be miltefosine. So remember, if they ask you the treatment of Leishmania, Kala Azar, it is liposomal amphotericin B, but for post Kala Azar dermal leishmaniasis, it is miltefosine. Let us do some very quick fancy naam. This is a question that again came in NEET 2023. What is going to be Leishmania tropica that it is causing? So Leishmania tropica causes something called the Delhi boil or the oriental sore or the Aleppo button. All these fancy names were given. Delhi boil, Aleppo button or oriental sore, and that is going to be Leishmania tropica. What does Leishmania brasiliensis cause? It causes mucocutaneous leishmaniasis, also known as espundi. Espundi is something that is caused by brasiliensis. Last one, Leishmania recidivans. Recidivans means something is receding, something is kind of decreasing, kind of increasing, kuch recede ho raha hai. Means this occurs due to inadequate treatment. So this is how the patient is going to look like. The center area is clear, but there are lesions which are present around a central healed area. So the central area is basically healed, but around that central healed area, you will see lesions like this. That is known as Leishmania recidivans, which is caused because of inadequate treatment. That definitely wraps up all of your hemoflagellates, Leishmania and Trypanosoma, which means we can now take up the next family, and the next one is the coccidian parasites. Let's begin with the next family, and these are the coccidian parasites. Now this includes Toxoplasma gondii, that is going to be one separate organism, and the other three are going to be Cryptosporidium, Cyclospora, Isospora, which is one diarrhea wala family. And in the end, you hardly get any question on something called Sarcocystis. These are all the coccidian parasites. So first we'll start with Toxoplasma gondii, and please note this has a definitive host in the form of a cat, which is the most important. So this is the cat wala, cute little cat wala life cycle. And then the humans, actually if you realize, the humans are getting infected as an intermediate host. So this is what you have as a human. So definitive host is cat. What are the definitive hosts? In which the sexual reproduction takes place. So that is what you have. So now what are the forms which are going to come to us? So you will say that there are three forms: sporulated oocyst, or a bradyzoid, or a tachyzoid. And all the three forms can come to us in some form or the other. So remember what the cat passes in her feces. So imagine we are having to read about cat feces also. So when the cat passes something in the feces, that is going to contaminate the food and water, and this contaminated food and water is then going to reach us. So sporulated oocyst is something that comes via contaminated food and water. On the other hand, if we end up eating, because there's a life cycle happening amongst animals also, if we end up eating any undercooked meat, so what is going to come? It is going to be the bradyzoids. मतलब टिश्यू में कौन सा फॉर्म होता है? टिश्यू में होता है bradyzoids. However, if the same thing comes to us via blood transfusion, then what shall come to us is the tachyzoids. How am I going to learn it? See, pehle to learn the sporulated oocyst. This you can learn. Sporulated oocyst is going to come via contaminated soil and food and water. So now if they say unsporulated oocyst, so please note what the cat actually passes. I'll write this once again. What the cat actually passes in the feces is unsporulated oocyst. And then it takes some time in the environment to form a sporulated oocyst, and that is what is going to come to us. So if they ask you, is the fresh cat feces infective? No, the fresh one is not infective. It takes a few days for that sporulation to occur in the environment and then it comes to us. After that, you have to make sure you do BT. BT मतलब कि अगर blood transfusion पूछा है, will you write bradyzoids? No, ma'am. I have to make a combination of BT. So if blood transfusion is asked, I will mark tachyzoids. And if tissue is asked, like some meat or anything is asked, then I will mark bradyzoids. So bradyzoids is with tissue and tachyzoids is with blood transfusion. BT ka combination you will make. So what is Toxoplasma gondii gonna be? So also another thing that I've just told you, mother to child torch infection, of course. So congenital toxoplasmosis is a big problem, and you know the most severe infections occur when they travel in trimester 1. But the maximum chances of transfer from mother to child is going to be trimester 3. And what is that 3C and 2M that we study? So this is what you study in toxoplasma: chorioretinitis, cerebral calcification, and because of that there are convulsions. There's microcephaly and also mental retardation. I hope you remember this from your main lectures, that toxoplasma, because ये जो same चीजें लिखा है ना, all of these are also seen in cytomegalovirus happening in the child. Cytomegalovirus happening in a congenital infection shows you exactly that, but toxoplasma shows you what calcification? Cerebral calcification, whereas your cytomegalovirus has the vena, so it shows you the, again in the brain only, but which part of the brain? It is periventricular calcification that you're gonna see in cytomegalovirus. यहाँ पर in the cerebrum you see. That is what you have to differentiate. So which one shows you periventricular calcification? Cytomegalovirus. This is where it happens mother to child. When it happens in an adult who is fit and fine, immunocompetent, agar immunity is good enough, I'll put a tick mark, immunity is good enough, so most of them can fight it off. It is going to be an asymptomatic infection. If at all something has to happen, maybe some lymph node will be enlarged and that's about it. But when it involves an immunodeficient person like HIV, so brain involvement hota hai, and they ask you what happens in the brain? Encephalitis. And what is going to be the most common part affected? It is the brainstem which is most commonly affected. That is the question that you get. So of course, the next question coming to your mind is, how do I do the diagnosis? What is the gold standard, guys? The gold standard for the diagnosis is going to be identifying the antibodies using the Sabin-Feldman test. It is a kind of a test which uses what? Which uses methylene blue. So I don't want you to learn the full, the full procedure of this, but please note that at the end of the test, if you don't get a color, if there is no color, colorless, this means, or I will just write colorless, if the color is not obtained, this means the antibodies were present. Opposite chalta hai, theek hai? So if color of methylene blue does not come, this means the antibodies were present. And if the color comes up, this means the antibodies were not there. The test is a little lengthy. Of course, you can refer to the main videos for the full 5-minute description of it. But the end result was this, or opposite hoga. Color aaya to no antibodies, color nahi aaya to antibodies are there. However, now we have much more advanced testing. So first tell me, if IgM comes out, what will you say, ma'am? This is a recent infection. Everywhere IgM acute infection. If IgG comes out, but there are two IgGs you have to figure out over here. If it is a low avidity IgG, then also still it is an acute infection, because initially the IgG that is formed is low avidity. Only when the IgG starts forming to be of strong avidity, that is when we say that this has gone into a long-term and a chronic infection. Okay, so now on that note, what is the treatment? The last point, it is pyrimethamine with sulfadiazine, which is given as a treatment for toxoplasma, which you read in Pharmac, and this family is done. Now in the same coccidian parasites, I come to Cryptosporidium, Cyclospora, Isospora. Why are they one family altogether? Because they cause diarrhea in what people? people, in immunocompromised people, you will always get an HIV positive person with diarrhea. That is very important for you to know. Now, please note, out of these, I will first teach you what are the differences between them in terms of their sporozoites and sporocysts, and then I'll take you into the life cycle and the differences. So please note that first, everywhere you must have noticed I have written it in an alphabetical order. Cryptosporidium, Cyclospora, Isospora. Alphabetical mein likha. Now tell me, how many sporozoites does it have to begin with? Cryptosporidium has 4 sporozoites. Fine. Next, how many sporozoites does this have? Cyclospora, you will say, ma'am, this also has 4, but cycle ki tarah hai. Cycle ki tarah matlab 2 are gonna be aage, 2 are gonna be piche. There are 2 tires of a cycle. Cyclospora has 2 cycles wala tires. So it has 1 tire over here, 1 tire over here, and 2 are split in each. Isospora is even bigger. This also has 2, but it has 4 plus 4 sporozoites, means it has a total of 8 sporozoites. So if you just have to make a number game, you will say 4, 4 and 8. 4 sporozoites, then Cyclospora also 4 sporozoites but split into 2 plus 2, and Isospora is 8 sporozoites split into 4 plus 4. Is that okay? Because now I can teach you that what is going to be the most important table that you have to know out here. Look at this, guys. Cryptosporidium, Cyclospora, Isospora. Again written in an alphabetical order. If I ask you what is the size of the cyst going to be, it is 4 to 6 microns in case of Cryptosporidium. Double kar do, it is 4 ka double is going to be 8, 6 ka double 12. So Cyclospora is 8 to 12 microns, and 12 ka double triple 24 to 36 microns is going to be Isospora. Okay? So alphabetical order and keep on doubling. What is the shape? Look at their alphabets. Their alphabets will tell you their shape. Cryptosporidium, Cyclospora, Isospora. Cryptosporidium, complete the, what will you get? You will get a round shape. Cryptosporidium is also round. Cyclospora is also round. And Isospora can look like this. So this is going to be an oval shape. Which of them are acid fast? All of them are going to be acid fast. But Cyclospora, cycle ki tarah hai na. Cycle, I've always told you cycle. So sometimes it is acid fast, sometimes cyclical, sometimes it is acid fast, sometimes it is not acid fast. So they ask you which of them is variable acid fast. That is Cyclospora. Who is gonna shine on its own? Autofluorescence, the Spora brothers. The Spora brothers are gonna shine on their own. What is gonna be the treatment? Of course, you remember from the main, the main story that I taught you in the main videos. The Spora brothers are treated with cotrimoxazole. But what do you treat with nitazoxanide? So I have told you Nita Ambani ke paas cryptocurrency. Lot of money, of course. Nita Ambani has a lot of money. So Nita Ambani, that is nitazoxanide, is going to have cryptosporidium or cryptocurrency, and that is the treatment for cryptosporidium. Whatever I have taught you, I want all of you to look at it under this. So firstly, you say that, ma'am, the easiest to pick up is this oval wala because Isospora is going to have that shape. Isospora is going to have that oval wala shape, right? These are the round ones. So one of them is Cryptosporidium, one of them is Cyclospora. See, all of them are acid fast. Yep, all of them are acid fast. Whereas over here, this is acid fast and this is totally white. It is not acid fast. It's cyclical show kar raha hai. That is going to be Cyclospora. Sometimes it is acid fast, sometimes it is not acid fast. So variable acid fast. Whereas Cryptosporidium, the first one that we have, that is going to be acid fast for sure, right? Now, what are the last 2 questions which are important? One is from microbiology. Which of them can be associated with eating of raspberries? So remember, cycle pe aage wo jo ek, there is a basket na in front of every cycle. So uspe what are you going to put? You are going to put some raspberries. So cycle pe raspberry lene gaya. This is because of raspberry consumption. This is because of raspberry consumption. So remember, Cyclospora is everything to do with cycle. Like a cycle, it has 2 sporozoites aage, 2 piche, right? Like a cycle, sometimes it is acid fast, sometimes it is not. And on that cycle, I have kept a bunch of raspberries because this is because of raspberry. This is because of raspberry consumption. The next and the last question that you have is with regard to Cryptosporidium, and that is a question that you get in pathology a lot. So now what is the question that you get in pathology over here? I hope all of you remember this image which came in the previous year AIIMS paper. I have taught you this in the pathology lectures also. This is a case of Cryptosporidium because the problem is, or you can say the differentiating point is, that Cryptosporidium is a little different from the others. First point of cryptosporidium is that it can cause auto-infection, right? It can cause auto-infection. We can infect our own cells as and when, while being infected, we can infect ourselves. And secondly, when it goes on to the intestine, it doesn't go inside the intestine. It gets attached to the brush border of the intestine. So, it's like a crypto, it's a cryptocurrency, like I was telling you. Crypto means something that is hiding. So, it decided that I'm not going to go inside the cell. No. I am going to make a tunnel and hide over here. I'm going to make a tunnel and hide along the brush border. I will not go inside the cell at all. I will hide in a tunnel, and that is going to be by the formation. What is that tunnel that it has formed? By a tunnel known as parasitiforous vacuole. So this cryptosporidium has made a full cryptocurrency. Crypto means hidden. So first remember, this is the one that is hiding in a vacuole called parasitiforous vacuole. Another question of crypto that you'll have to know is that Nita Ambani has crypto. So Nita's oxonide is the treatment. And this third mnemonic in this entire thing for cyclospora that you have to know is that cycle ki tarah hoga sab kuch, and you are going to carry raspberries on a cycle. So that is by raspberry consumption. So that marks the end of the entire coccidian parasites. What do we move on to next? We now move on to the next one, and that is going to be the hematozoa. So you know hematozoa includes what? Malaria and Babesia, right? Of course, malaria is the one that requires more of my attention. Babesia is just for 5 minutes. So what is it about malaria? What are the different kinds of malaria that you have to know? We have something called malaria vivax, falciparum, malariae and ovale. Everyone remembers these 4 malaria that you have? Jo chota wala naam hai. When I say vivax, it's a chota wala naam. And when I say ovale, these are 5 alphabet things, chota chota. So they have the chota wala word, and that is relapse. Relapse is seen with vivax and ovale. And where do you see this lengthy name called recrudescence? So you will say, ma'am, falciparum is a long name. And Plasmodium malariae is also a long name. That means the lengthy names are going to show me the lengthy recrudescence. So you will now ask me the difference between these two. What is relapse? Relapse is the activation of hypnozoites. So whatever malaria came into my body, and in my body it went and got hypnotized. Hypnotized matlab bilkul wo blank ho gaya. It started hiding in the liver. Now when they get reactivated, reactivation of the hypnozoites, that is going to result in a relapse. Whereas what is recrudescence? Recrudescence means inadequate treatment. Inadequate treatment or incomplete treatment was given, as a result of which that there is a recrudescence or a reappearance of the disease that has happened, or the disease has gone on for a longer time. That's the difference between the two. So remember, chota wala naam is for the chota wala organisms, and the lengthier name is going to be for the lengthier organisms. So if you didn't understand what are these hypnozoites, let me quickly tell you the life cycle. Guys, who is the definitive host? We know it's the female Anopheles mosquito. The female Anopheles mosquito is going to be the definitive host. Who is the intermediate host? Of course, us. And now I know if female Anopheles mosquito is going to be the definitive host, this means the sporocytic cycle, the sporogony or the sporocytic cycle, or you can just say sexual reproduction will happen there. Definitive host may the sexual reproduction, male, female gametocytes and all of that fusion is going to happen. Whereas in humans, we are the intermediate host. So what happens in us? How do we get it? As you said, the female Anopheles mosquito is going to bite us. And what are we going to get from the saliva of the female Anopheles mosquito? We get the sporozoites. The sporozoites in the saliva are going to come, and which part of our body do they go and infect? Guys, we all know it. They're going to go into the liver. That's the first part they go into, and in the liver, then they start developing. They make something called schizont. After making a schizont, the schizont is going to like this, a balloon ki tarah, the schizont is going to rupture. So where are they all going to go now? Liver mein gaye, they developed a little and then balloon burst. Now which is the next organ that they will go to? Now they are going to go, and their journey will continue in a red blood cell. So how does malaria, for example, if this is a red blood cell, how is the malaria organism going to come and attach to it? So you will say, kaun sa malaria hai, ma'am? Have you got Plasmodium vivax or have you got Plasmodium falciparum? These are the two main ones. Because if you've got Plasmodium vivax, in my blood, there is something called Duffy antigen which is going to receive it. And if you've got Plasmodium falciparum, then in my blood, there is something called Basagin which is going to receive it. So now what is going to receive it will depend on what malaria has come into my body. Vivax has come, so Duffy antigen will receive it, and falciparum has come, so Basagin will receive it. Once we have received it, once the red blood cell has received it, TSG banta hai. TSG is not tumor suppressor gene. TSG is, first thing formed is a trophozoite. From a trophozoite form next is a schizont. तो या तो ये trophozoite schizont का cycle चलता है, और the trophozoite is now gonna form gametocyte. So like I said, there is TSG. Trophozoite is formed, schizont is formed, gametocyte is formed, and finally what is the form, male female gametocyte, which the mosquito is going to take back? So which is the form that is infective to the mosquito? To the mosquito, the gametocyte is going to go, and please note there have to be at least 12 gametocytes that are present per microliter of blood mean that can make the infective. So how many of the gametocytes should at least it take up? It should take up at least 12 gametocytes per microliter, male female gametocytes. So now if I ask you a question, what is the form which is going to be infective to man? So simple, what is the form that is going to come to us? तो हमारे पास जो saliva से आएगा sporozoid will come to me, and what is the form that will go from me away to the mosquito? That is going to be the gametocyte. So infective to me is the sporozoid, whereas infective to the mosquito is gametocyte. But have you also heard that malaria can happen via blood transfusion? Yes, not via mosquito, via blood transfusion. Which is the form? It will directly enter here. Everyone please mark. Malaria will directly enter at this stage. This means at the trophozoite stage. So when it is going from blood or mother to child, it is the trophozoite stage at which the malaria directly enters. So can I say ye wala pura liver wala cycle is only going to go away? In blood transfusion malaria, there is no liver wala cycle, because now I'm going to tell you, sometimes this malaria is very, very lazy. Malaria comes in the liver and says, I'm going to sleep off. What is that sleeping form known as? Hypnozoites are going to be the inactive form that is present where? In the liver. So they tend to sleep off. And some later age, after many, many days or weeks, they will suddenly wake up, and then they will result in what? They will result in relapse. But now if I'm talking about a blood transfusion wala malaria did not have the liver stage. So can you have relapse in blood transfusion malaria? No. And that is what I wanted to know. There is no relapse that you see in malaria with blood transfusion, and that could be a question in your Central Institute exams. So this was your basics of how malaria is working. So now if I ask you that what are the people who are going to have a resistance, immunity against malaria, you'll say, ma'am, malaria, when it came into my body, it required an antigen called the Duffy antigen. If there is someone who is born without a Duffy antigen, Vivax will never ever be able to infect that person. So Duffy negative RBCs are going to be immune. Second, you are saying malaria is attacking the red blood cell. If there is a red blood cell problem, red blood cell ka shape ka problem, enzyme ka problem, ya hemoglobin ka problem, so you will say that, ma'am, when the red blood cell is only not going to survive for 120 days, how will the malaria survive inside it? So basically, in all these situations, the survival of malaria is going to be reduced. That is why these people become immune. Whereas when Duffy is not there, then attachment of Plasmodium vivax cannot occur, and that is the reason again the patient is immune. So what are the features of malaria? Benign malaria, there is going to be a patient with fever and chills. Of course, this is a very, very simple thing, and after that this fever is going to come down with a lot of sweating. Ye to basic pata hai. But what is malignant malaria? Malignant malaria means that the patient has cerebral malaria. Guys, I want to ask you, from pathology in cerebral malaria, what was the granuloma that you had seen in pathology? Yes, it was the Dirk granuloma. Correlation. Next, can malaria have black water fever? Fever to pata tha, ma'am. What is black water? Hemoglobinuria. Possible hai. There can be blood breakage. There can be hemolysis. Hemoglobinuria will make it black urine. So black water fever. Renal manifestations. Yes, now we know that malaria has been associated with MGN, membranous glomerulonephropathy, basically nephrotic syndrome के साथ associated है. And finally, algid malaria, in which malaria has been associated with circulatory failure. Malaria associated with circulatory failure, and that is going to be algid malaria. But whatever I'm talking about are those four main: Vivax, falciparum, malaria and ovale, because now we also have something known as malaria knowlesi or Plasmodium knowlesi, which is basically come up in Malaysia from the monkeys. MNM, it has come up in Malaysia from the monkeys, that is Plasmodium knowlesi. Now, of course, you are going to go ahead with the lab diagnosis, and I've always told you that for the lab diagnosis of malaria, you have to give me maximum attention. That means that the light microscopy is the gold standard. Pathology microbiology people are going to be the ones who are going to be needed for it. So we'll start one by one in order of this. We'll bookmark this slide and we'll keep coming back to it. Let's start from the gold standard, which is the light microscopy. What do? I make a thick smear, and I'm also going to make a thin smear. What is the purpose of making these two smears? Because the thick smear, I will use more quantity of blood. This is basically for counting, for quantification of malaria. That okay, there are 100, 200, 1000, how many malaria are there? Thick smear will tell me. But if I want to do the species identification, we are going to go in for the thin smear. That is very, very important. So that is the gold standard. So acha, smear bana liya, how do I stain it? What has been proposed by the malaria program is the Jaswant Singh Bhattacharya stain. It has been proposed that we have to use the Jaswant Singh Bhattacharya stain, also written as JSB. Okay, so now tell me, what is the, if I say you are examining this slide, you say, ma'am, you kept looking at it for 5 minutes, 10 minutes, 20 minutes, kab tak? You were not seeing any malaria. So, kab tak dekhoge? Till when will you see? Is there any standard protocol? Yes, you have to examine 200 to 300 oil immersion fields. Under oil, you find malaria. 200 to 300 fields you see. If you still don't find anything, then you say, it is pakka negative. So what is the sensitivity? Remember, for a thick smear, the sensitivity is 5 parasites per microliter, and thin smear 200 parasites per microliter. So I'll write it over here. 5 parasites per microliter and 200 parasites per microliter is the sensitivity. This was the gold standard. But now what are you seeing? Microscopy mein dikhega kya? Slide to ho gaya, but what are you going to see? Firstly, you're going to see some dots and clefts. You don't get pictures of this, you get more of theoretical information. Microscopic examination shows you Vivax mein the very, very famous Schaffner's dots. So how am I going to learn it? Viva mein there is going to be shuffling. The Viva examiner is never going to ask you chapter wise like I'm teaching you. Viva examiner will ask you anything, cystode, trematode, coccidian, kuch bhi. Schaffner's dots, so shuffle hoke aayega Viva mein is how we've learnt it. Falciparum, ulta pado, M-A-U-R jaisa. So what is that going to show you? That is going to show you the Maurer cleft. Next, malaria is going to show you Z-man dot. Malaria shows you Z-man dot. And ovale has 5 alphabets, so that is going to show you the James dots. So everyone's learnt it. Viva mein shuffling. Falciparum is going to be showing you Maurer's clefts. Malaria will show you Z-man dots, and ovale is going to show you the James dots. Now finally tell me, what is the pigment that you're going to see? In all of them, there is a pigment of malaria known as the hemazoin pigment, which all of us definitely have to know. So, ye to sab theory ho gaya. What do you actually see under the microscope? Under the microscope, we always have to look out for T, S and G. We always see TSG. What is TSG? Again, like I was telling you in the life cycle, it is a trophozoite, it is a schizont, and it is a gametocyte. Trophozoite, schizont and gametocyte is going to be noted. So, dekhe ek saath, we are mainly concerned in this row. Plasmodium vivax and Plasmodium falciparum. Let us see. So, how does the Plasmodium vivax look like as TSG? So, trophozoite. Let us start with the trophozoite. This is nothing but a ring form. Trophozoite is nothing but a ring form. How many rings are you seeing over here, ma'am? So simple. I am seeing just one ring over here, and inside that one ring, I am seeing one dot. I'm seeing one ring and I'm seeing one dot inside it. How easy? Because I will learn Vivax had the one ring and one dot. Simple now. Vivax, one ring, one dot. That is an early trophozoite. Now when it becomes late stage mein, it's still a ring. Try to trace it. It is still a ring, but it has become a mota wala ring. So that is why over here, this is known as the amoeboid form. This is known as the amoeboid form. Finally comes T ho gaya. Trophozoite is done. T, S, schizont. Schizont has these multiple dot things inside it, which are referred to as the merozoites. And finally comes the gametocyte. What is the shape of the gametocyte that you see over here? It is a spherical gametocyte. Macro is known as female, micro is known as male. I've always given you a mnemonic that macro matlab females ko zyada importance. Females have to be given more importance. So now tell me, how will I differentiate? Both of them are spherical. The one which has, can you see there is a chromatin, kahan present hai? The chromatin is going to be seen at the periphery, whereas isme the chromatin is seen at the center. That is how you differentiate male versus female. So remember, if the chromatin is going to be eccentric, that is a female gametocyte, and if the chromatin is going to be central, that is going to be a male gametocyte. This is how you identify different Vivax species, because now I will tell you the classification and the identification of Plasmodium falciparum, but I don't see too many pictures. All that I see is a trophozoite and a gametocyte. Ma'am, TSG देखना था. Trophozoite and gametocyte तो है. ये schizont कहाँ गया? Plasmodium falciparum का schizont is not seen in the blood. Why is that so? Because this is present in the cerebral circulation. That is why to we say na Plasmodium falciparum causes cerebral malaria, because these schizonts are only for Plasmodium falciparum. Remember, these schizonts are not seen in circulation. They are going to be seen only in the brain vasculature, not in your simple finger prick blood sample. So good for me na, schizont ka photo hi nahi dekhna blood sample mein. I just have to see trophozoite and I have to see gametocyte. So let me talk about the trophozoite. Do you see like Vivax had one ring, one dot ऐसा? यहाँ पे ये तो नहीं है ना? You see many rings and many dots. So trophozoites are going to show you the presence of multiple rings and multiple dots, and so many rings are there that some of them say, "अरे जगह नहीं है, there is no space. Let me go and sit in the corner because I don't have any space." So what is that ring known as? That is known as an acole or an applique form. So please note, it is a ring that has gone to, or that has gone and decided that I will attach to the margin or the membrane of the red blood cell. The margin of the red blood cell, that is known as a acole or applique form. Now coming to gametocyte, I can see the shape. It is going to be a banana shape. Now I just need to know what is male and what is female. So I've given you that hostel room wala mnemonic. Ke males ka hostel room dekho, it is all scattered and messy. The chromatin is all over. So they will say that male gametocyte mein the chromatin is all over, means the chromatin is dispersed, whereas girls are very organized. Look at the girls ka chromatin. Girls ka chromatin kaisa? Well organized. And that is what you're going to see. In female gametocytes, the chromatin is going to be well organized. Exactly how you see the girls ka room versus boys ka room, versus this is not a real scenario, because even our rooms are pretty dirty and messy. But yeah, boys are more messy is for the mnemonic we are learning. So yes, inka chromatin is all over and females ka chromatin is going to be well organized. So that is also done. Ab kya bacha? We are left with Plasmodium malariae, Plasmodium ovale. They also show me the same TSG wala story. Nothing different. The only difference is going to be the Plasmodium malariae ka trophozoite. Ma'am, everywhere trophozoite was a ring. यहाँ पर band हो रहा है. So what have you learned? Students always learn it as mala band. Mala band means that mala for malaria is not going to show you that round ring. It is going to show you a band. But है तो वही ना. See, ring was looking round like this. इसको पिचका दो, just squeeze it, it's going to look like a band. So this is a ring and this is a band. So mala band, Plasmodium malaria, shows you the presence of a band form, and then the lengthiest lab diagnosis, that is light microscopy, is done. The next one is said to be the fluorescent microscopy. What is that known as? Kawamoto technique. Which fluorescent dye do we use for malaria? It is going to be acridine orange. For malaria, we use acridine orange. Microscopy is done. Let's move on to the third one. The third one is quantitative Buffy coat. This is one slide as a flashcard for quantitative Buffy coat. Quantitative means I can count the malaria, but what is the sample that I take? Buffy coat sample is what I'm going to take in this patient. Buffy coat kya hota hai? Ma'am, in a blood, if you see, the bottom part is always the red blood cell. The top part is always the plasma, and in between the two we have something called as Buffy coat. So all the parasites are actually going to live in the Buffy coat. So what will you do? You will take a capillary, patla sa capillary tube, with a finger prick you will fill it with blood, and after that you will see that in the Buffy coat, let me put some dye and see malaria. तो dye अब बाद में थोड़ी डालोगे. Blood is already in this. How do I put dye? So put dye beforehand. Now this tube is already lined with which kind of dye? This tube, QBC, uses fluorescent dye. From beforehand, it has added a fluorescent dye. I just told you the fluorescent dye for malaria, and what is that? That is going to be acridine orange. The fluorescent dye for malaria is acridine orange. So when you saw this entire tube under, like tube aise ka aisa, you look at it under the microscope. I saw under the microscope, I said, oh yes, there are things which are shining. I can count them also. This is quantitative. So this is referred to as quantitative Buffy coat. What is the sensitivity? Please note, QBC has a sensitivity of 2 parasites also per microliter of blood. Coming to the next technique, and that is referred to as the rapid diagnostic test. Rapid diagnostic test is very rapid. It is a card test. Okay, so card test kaisa dikhega? This is how a card test is going to look like. Firstly, it is definitely one rapid test. After COVID, you all know that every card test is a rapid diagnostic test. But they will ask you, what is the principle of this test? Remember, immunochromatography is the principle of this test. Any kind of card test that is asked. It could be COVID wala, hepatitis B, C, HIV, urine pregnancy card test, malaria card test. Sabka principle is going to be immunochromatography. And what do you see over here? You have a control line. Control line always has to be present because that tells you that the test is valid. If the test line, now this is different. If the test line is positive or negative, that will tell me whether my patient is positive or negative. And what is the sensitivity? For the card test in malaria, it is 50 to 100 parasites per microliter. So let me now tell you, these are the different malaria cards that you have. Please note, all malaria species have antigens called, all malaria species, AL for aldolase and AL for aldolase, and single L is going to be lactate dehydrogenase. So all the malaria species have aldolase and LDH. On the other hand, Plasmodium falciparum only not others, only Plasmodium falciparum. तो देखो ये सब तो Plasmodium falciparum also has aldolase, it has LDH, it has, but Plasmodium falciparum has histidine rich protein 2. It has HRP2 or histidine rich protein 2, which is extra, and only falciparum has it. So tell me something. First, when you look at these, first thing notice is the control line. Ma'am, control line to hona chahiye. If control line is there, this means it's a valid test. So yes, I will be reading these 3 cards. But over here, control line is not there. This is an invalid test. Please do not read this. Ise discard kar do. Don't give the diagnosis. Okay, over here, I don't see anything under pan malaria, anything under Plasmodium falciparum khali hai. This is negative for malaria. Here I see a line under pan malaria, but not in falciparum. This is malaria to hai, but falciparum definitely nahi hai. And if I see lines in both, malaria to hai, either it is a falciparum malaria or it could be some kind of mixed malaria like Vivax and falciparum ka combo infection, Vivax and ovale, falciparum and one falciparum to hai hi. Ya to akela it is falciparum or it is a combo of falciparum with something else that has occurred over here. That is how a card test is read. The recent exam question was, what are the antigens present in all the malaria species? All ko split karo, aldolase and LDH. And which is the antigen present in Plasmodium falciparum? Histidine rich protein 2. But if you are asked that which is the most sensitive test that you have, of course it is PCR, but again and again telling you gold standard is still me. Come back to me, don't take away my market. Light microscopy is the gold standard for malaria diagnosis. After malaria, I told you that we will be doing something called Babesia. So that's the last slide that you have. And that is also a hematozoa. Look at this. This is the most expected picture for Babesia. Ma'am, this is also showing you the same rings like malaria was showing you. Yes, but here the rings are making a tetrad. There is a tetrad of rings that are formed, and this is referred to as the Maltese cross appearance. This is the Maltese cross appearance that you see. We have 2 Babesia, Babesia microti and Babesia divergens. Both of them are spread by a tick bone, that is the heart tick. This is heart tick. So what was malaria? Female Anopheles mosquito. What is Babesia? It is a heart tick. So Babesia microti को हमेशा micrati याद रखना, because what is it going to show you? It is going to show you the very famous host, and that host is what? That host is going to be the rodent. So you learn Babesia microti as ratty because rodent hoga. Whereas what is it with divergence? Divergence is going to show you the presence of cattle. तो एक याद रख लो, Babesia microti. Please learn microti as micrati. That will tell you rodents are involved in its life cycle. Okay, moving further, we can very well see over here, I have Fever, malaise, chills, sweating. Is it just like malaria? Clinical features just like malaria. Treatment is different and a little different only. So you can see azithromycin and atovaquone is what is used as a treatment, but in severe cases you can also use clindamycin and quinine. So these are different modulations or permutation combinations that you do for the treatment of Babesia. And that definitely the question that you expect will always and always be the Maltese cross appearance. Yes, guys. So we are finally done with the Hematozoa also. What are the last three families that we have to quickly revise, and for which I've got you like, the entire families are going to finish off in like two tables. Cystodes, trematodes, nematodes. We have to make two tables, all the hosts, all the eggs, all the life cycles, all the treatments, make the tables and wrap them up very quickly as possible.